My name is Dr. Victor Williams, and I practice at Surgical Associates of Arkansas. I think using the app has helped healthcare tremendously. Helps our patients. We have tighter control of blood sugars, tighter control of blood pressure. What we do is have the telemonitoring service where the information, the blood pressure, the weight, the glucose changes, the patient monitors that at home. And we get help with that with the Health Wealth Safe program.
I'm able to access data points in my diabetics. If there are variances in blood pressures, blood sugar readings, then I'm immediately notified. React to that by scheduling an appointment for the patient to come in or implementing medication changes or adjustments.
If you monitor a patient's blood sugar, their weight, then it gives you a good idea of how that patient's doing. We like to get their health care to an extraordinary level, typically from close monitoring.
Patients who only see their doctors from time to time, they don't necessarily feel as safe and secure as the patients who know their doctor is truly looking out for them.
When you go to the ER, the problem is not your diabetes, but it's your elevated blood sugar. So once they address that blood sugar, you're now stable, then you're no longer a patient there. They're simply addressing a problem right then. The diabetes needs to be treated. That can only happen through a personal relationship so that collectively a treatment plan can be developed to address whatever the underlying issues are.
I love the fact that we can monitor the blood pressure right along with the patient as well. So they don't have to write it down and keep up with that piece of paper. So anytime they take their blood pressure, we're able to see what their blood pressure is.
When we get an escalation, meaning that something's out of the ordinary, the blood pressure is severely high or severely low, it's very easy for me to monitor that because we'd find out easily what the issue is and I'm able to address it very quickly. With the Health Wealth Safe program, it's a continuum and you see the same service. You see the same physician. It establishes, I believe, a great rapport between the patients. I think they will have a great connection with their physician because the physician is monitoring these things all the time.
Another benefit of the program is the chronic care management aspect in which patients are actually contacted not because of a variance or because of an abnormal reading. We're contacting just to assess your wellness. For someone to just call them and say, "Miss Jane, how are you?" We're just doing a check-in visit. I mean, it speaks volumes and the patients really, really love it.
I would recommend this service to other physicians because it decreases the amount of time needed when you're taking care of patients. You can review things quickly based on the information that you receive from the Health Wealth Safe team. Sometimes the patients think of things when they go home, and that helps in their overall outcome. It helps me understand the patients, and I like this program very much.
My name is Dr. Karen Luster, an internal medicine physician at Compass Primary Care. I had a person do demographics and I said, I want to go where there's a need. And she says, 2 places, someplace far away, I want to go there. And she says, by the airport. She says, you will not believe it. She says, there's no doctors out there. I said, seriously? I said, yes. And she says, they all smoke, they have diabetes. I said, yes, they need a doctor. I can actually be a mom. It also allows me to see the patients, take care of the population that I really love taking care of. There's a lot of illness, sickness out here, and patients are very grateful when they meet you because they realize that somebody's out here for them. I really chose to be on the MARTA line too because I wanted to make sure that people who needed to get to a doctor could get to a doctor, whether it was by car, public transportation. because all my patients use all those things. And a lot of patients who did not have access to get to the doctor can actually come over here and see me. So that was nice. The biggest thing patients tell me, they say she listens. And I always find that funny because I never thought of a doctor as not listening. I always brag about Tulane. Tulane was really big about talking to patients and get the information you need to take care of your patient. I see you're looking at the brochure for Health Well Safe. We've partnered with this company to help us manage people with chronic care conditions. If you have more than 2 chronic conditions, we can help manage you remotely. And that way, you can get a device where you can measure your weight, your blood pressure, blood glucose if necessary, so we can see it remotely. Data shows that this actually helps people live longer and stay safe and stay healthier. And what's also nice is they have patient care managers who will call you and keep you motivated and remind you to check your blood pressure or your blood glucose, those type of things to keep you healthy with the information coming to my computer system. Also what's nice is the fact that the information will go into the computer system and I can see it without you being present. And then when you come for your visit, we go over these things to help keep you at your best health. Does that sound like something you could possibly be interested in? I think most doctors wonder, how can you do it? We don't have the time to do more stuff. Everything now is online. Medicare makes you do things online. So I think just the culture of medicine is moving in that direction. For a physician to do what's required from us, from the government, it takes over 24 hours. Anything that you can do to get good patient outcome, decrease morbidity, mortality, and save you some time, I mean, what else can any doctor say? Someone is giving you escalations, someone is giving you your trend of the vital signs. This can go under one less thing I have to do. And if anything can reduce burnout, it makes us all happy.
Hi, this is Jamie calling with Dr. John's office. I was trying to reach Miss Stacy. Hi, my name is Jamie Jaimo. I am a care manager at Health Well Safe. Hi, Miss Stacy. I was just calling to check in with you today. How have you been feeling? We reach out each month to check in on our patients in between their appointments. In doing so, our patient had an out-of-range response, which we called needs attention. Let's continue with our call. Okay, and when was the last time you checked that? Okay, and is that pretty typical for you, or is that something that's concerning you any? Okay, it's not normal. Is that something that you want me to get over to Dr. John for you today, or is it something you're just watching? We would never let a patient know that their response is out of range. We don't want them to feel concerned that their answer isn't normal by standard baseline. Everybody's health does not fit in one box, and what is normal for you may not be normal for another person, or what the standard medical baseline is. Okay, well, I'll note that down. And how have you been sleeping lately? Good, and is that pretty typical for you? No, okay. Would you like to get a little bit more sleep, or is there anything just not going on right now that's stopping you from sleeping well? We check in and ask our patients about their sleep just because so many things can fluctuate depending on what's going on regarding their health, and that's a sure way to find out if there are some underlying issues going on. Okay, well, I'll note this down. Would you like me to just keep this in the notes or get it over to Dr. John as well? Okay, we'll note that and see if it gets better. And how are your medications treating you? Have you needed refills, or have you had to miss anything? We make sure never to give our patients medical advice, as we are not allowed. That is handled directly by their practitioner and the practitioner's staff. We also check in on our patients' medication status. We like to be available for getting them any refills they could possibly need, or if they have any issues with their medications that their physicians need to be aware of. Wonderful, then. Well, Miss Stacy, I'm going to put this all in your chart just so we can keep an eye on it. If anything worsens, just give us a call. I'll also call again next month around this time to check in. And you're sure there's nothing I can get over to Dr. John for you today? Okay, we did a monthly health check-in where our patients had a couple out-of-range responses to their health questions. These questions were not a concern for our patients, so we would notate them down to make sure that we have a history of what was going on, but as it was not an issue, we did not escalate them to their doctor. If they do become concerning for the patient, we have this noted and we can refer back to our notes what's been going on and how long. All right, thank you so much, and I hope you have a great day.
I'm Dr. Bantal S. Palika. I'm an endocrinologist. My office is called the East Alabama Endocrinology PC. We have a website also. and I have another office in Columbus, Georgia. Then I have satellite offices in LaGrange, Georgia, and Athens, Georgia. We use all these technologies to do what is called as remote patient monitoring. For example, we have partnered with Dr. Subodh Agrawal. He has a program called Health Wealth Safe. It's an app on the phone, and this is a very good tool for me to keep an eye on a lot of my patients, what we call as a population health control. It is not enough to see patient one time in the office or see them once in 3 or 4 months, because things can go horribly wrong in between. So the idea is to remotely monitor these patients' blood sugars when they are at home, and the data gets sent to us over the internet, and we have an access. We have point people who keep an eye on all these patients, and I get notification if there are issues. For example, somebody having repeated hypoglycemic episode, somebody is having blood sugars of 400 and 500 all the time. So Health Wealth Safe is one of the best ways for me to do this population control and keep an eye on all my problematic patients who need more assistance. Now, this will help our patients not to go to the ER, because we are trying to save money for Medicare and other insurance companies. Because if a severe hypoglycemia happens and if the patient has to go to the emergency room, that means about $10,000 to the insurance companies. So that's why the remote patient monitoring comes into play. I'm very happy because I have a huge population of patients, and as a single physician, I'm unable to keep an eye on them all the time. That's why when Dr. Subodh Agrawal approached me with this Health Wealth Safe, it was a welcome idea for me. It was an easy adoption. Dr. Agrawal has assembled a great team of people who manage this whole program. They call the patients and they give them enough information. They inform me as and when necessary. They create notes, and overall, we try to keep our patients safe. And patients are also very happy, saying that, yes, Dr. Balika is keeping an eye on me. So that's an additional layer of security.
The U.S. healthcare system is facing a lot of challenges, especially when it comes to medical waste. There are almost 14 million Americans with 3 or more chronic conditions that require frequent medical attention. As this population continues to grow, how can we best support these individuals in a dignified and cost-effective way? Introducing Health Wealth Safe, a proven healthcare technology company focused on reducing cost while increasing the quality of care for everyone. At Health Wealth Safe, we use our FDA-approved devices through bidirectional communication with our care managers and physicians. Our devices work remotely to passively monitor your activities of daily living. With the Health Wealth Safe app, you are able to keep track of activities such as sleeping, water intake, medication, and so much more. We promote patient health and can also detect early changes in health, such as physiological and non-physiological data, which results in early management of the illness and prevent hospitalization. When a significant change in behaviors is detected, an alert will be generated to our team of highly qualified care managers. The care management team will then reach out to you, and if needed, we will refer patients to their own physician. This also cuts down on medical waste that is created with testing or imaging that you may have already had in the past. Health Wealth Safe wants to help change the way the medical industry works by providing timely, affordable treatment where you can actually see the results. This will lead to a lower overall cost of healthcare and more satisfied patients. Our app not only helps you keep track of activities and medication, but you can also store all of your medical records in one place. We believe that you should be in control of who gets to see your information. Our software is very secure and encrypted. Even Health Wealth Safe can't access your information without your permission. If you decide to simply share your information with a loved one or a caregiver, they just have to download the Health Wealth Safe app. You asked for a better way to do healthcare, and we heard you. Let's do healthcare the way it should be done.
the kidney, whether it's normal, not normal? Do you know that? Yes or no?
Let's take a quick second. Jessica, please work out the audio problems that we're having. Right.
Okay. And the next question, the last question for this webinar is that, do you know what is your urine albumin creatinine ratio is? Yes or no?
One moment. Betsy said there's a timer running. It says it's still 4 minutes and 30 seconds to start. Does that make sense?
Nope. Everything looks great, Steve. We can proceed.
Sorry.
Okay. So the reason I ask you these questions is at Health Well Safe, we believe the best results for health achieved when the patient get involved, knowing the results, knowing the state of their health. And these two questions I ask you about the EGFR and the urine albumin creatinine ratio are essential for you to know how your kidney doing. So in order to talk more about your kidney, I will invite Dr. Kumar. Dr. Kumar, tell us all about how I can take care of my kidney, how I can stay away from dialysis, and before I die, I don't want to be dealing with dialysis. So tell us, what can I do to help myself?
Thank you, Dr. Agrawal, for this great opportunity. Dear audience, I bring greetings to you from India. These are early morning hours, and I'm sure it is evening for you. So the talk that I have designed for you is to make us aware of the kidney's importance in our life and aware of the causes of kidney disease, and to make you aware of the preventive aspects of the renal diseases and also the treatment methods. So let us go one by one. So let us see where exactly are the kidneys positioned. It is somewhat of a mystery to the common man that the placement of the kidneys. Common man thinks that kidneys could be reproductive organs, and they are not reproductive organs. They are very important organs for life, and they are present at the back of our tummy, and they are present in the abdomen. The size of each kidney is the size of one's own fist, and they weigh only 140 grams, and they are 11 centimeters in length. They are bean-shaped organs. And if you cut across these kidneys, you will find that these kidneys are populated by millions of small nephrons. These nephrons are worm-like tubules which are there, and there are 1 million per kidney. So much so to say that all of us are millionaires. We are all endowed with millions of chips of these nephrons, and this is a great endowment by the nature. And what about the blood supply of these kidneys? The body or the nature thinks that the kidneys are the most important organs in our body. So much so, they should be given a lot of blood. They should be enriched with so much of blood. The maximum amount of blood supply is to the kidneys. And you will be surprised to know that not even the heart, not even the brain receives as much blood supply as the kidneys. As much as 180 liters of blood is being purified per day. See the remarkable aspects of this organ. And 2 liters of urine is being produced, and the rest of 178 liters of purified blood is being reabsorbed. And this is a short clip of how kidneys are very, very important for the functioning of all aspects of all the organs in the body. They are the heads of the internal security force. Unless the kidneys are working in the pink of health, neither your heart nor the kidneys nor the liver nor any organs in your body is going to be working normally. And the sad aspect of it is that the kidney disease is an all-pervading epidemic, which is more you look for it, more you find it. And it is estimated that more than 850 million people worldwide have some degree of chronic kidney disease. And the sad aspect is that more than 90% of them do not know that they have early forms of kidney disease. So this slide tells us about the various functions of the kidney, starting from the maintenance of the internal environment and going on to the aspects of vitamin D metabolism, by which I mean vitamin D is a very, very important vitamin which is invigorated by the kidney. It is the active form of vitamin D is secreted from the kidney, and this sees to it that not only your bones but your immunological system is working at the peak of its health. And the third aspect is that the red blood cell production is also being monitored and very carefully looked at by these kidneys. And they also have the other aspects of the electrolyte and the fluid balance, which are very, very important for our body's excellent functioning. So what happens when somebody develops kidney disease? What is the fate of 100 patients? Supposing we have 100 patients that we have in our midst and we follow them over the next 10 years, you will be surprised to learn that these kidney disease, people with kidney disease don't die of kidney failure, but they die of cardiovascular disease. Be it acute heart failure or myocardial infarction or coronary artery disease or stroke. So you have a wide variety of reasons as to why they have increasing death rates. And only 27 of them will be progressing to chronic kidney disease, and only 8 of them will receive dialysis in the 10 years to come. So you'll be surprised, and also very important to know that the 68% of mortality due to kidney disease is borne by the cardiac disease and cardiovascular disease. So it is doubly important for us to learn to know the causes and also to prevent the progression of kidney disease. And it makes it doubly hard for us because kidneys are silent workers, unlike the heart, which makes always the sound of lub, dub, lub, dub. These kidneys don't have any sound. They are very silent workers, and sadly, they are silent sufferers. More than 90% of their kidney damage is very silent. And even the patients who suffer from kidney disease do not know that they have kidney disease when they judge their symptoms. They look and feel fine. They eat well, they sleep well, and they are carrying about their normal activities well. But if you test them, then you find that they have kidney disease. And this is where this talk and also early recognition is very important. Finding out early renal damages could be vital, and it is the stage at which the treatment is going to be effective. And what are the 2 important markers of kidney disease? That is the eGFR, as Agrawal was alluding to. eGFR tells you about the functioning of the kidney, and you make a diagnosis of the eGFR from, you make a calculation out of it from your blood levels of creatinine and also cystatin C. Cystatin C is a new biomarker which is more sensitive. It is able to pick up earlier diseases than even serum creatinine can pick up. And you also have another very simple test of testing your urine for the level of albumin excretion. And if you see the GFR, or the glomerular filtration rate, the rate is generally around 100. So you have a century in your mind. So this is 120 is normal. Between 120, you follow this cartoon from the right to left. From 120, there is a drop of 90, and then from 90 it drops to 60. So that is between the GFR of between 90 to 60, you have the early stage of kidney disease, and then the clock ticks, and you have this between 60 to 15, you have onset of kidney disease, and between 15 to 0, you have the onset of kidney failure. So this is the eGFR, and you have this urine albumin creatinine ratio. Again, when the important nephrons that I was telling you about, these nephrons, when they fail, the filtration, glomerular filtration basement membrane, which is just like a sieve, and this sieve starts leaking. Once you have a leaky basement membrane, the proteins leak out in the urine, and this can be picked up by very simple tests. And this simple test is in the form of a dipstick. You just dip the paper, this filter paper, into the urine, and there will be a color change. And these markers will tell you whether the protein leakage is mild, moderate, or severe. So if the kidney disease is far advanced, especially in diabetics, you will find that the urinary albumin excretion is more. There is more leaky kidneys, and this tells you that the disease is advancing very rapidly. So
Dr. Kumar, can I ask you a question? Just how much it costs to find out these two tests, like eGFR and the urine?
So I can tell you from Indian rupees that the serum creatinine is hardly around 100 rupees, which is $1, and the urine testing for protein is hardly less than $1. So this can be done on a routine basis, especially after the age of 40 years, especially in those people who are diabetics and who are having high blood pressure, at least once a year. And I tell you that on a birthday, rather than cutting cakes, you can do this simple test to make sure that your kidneys are fine, and then celebrate your birthday. So do this simple test on your birthday, and that will you can remember those days. So this is the estimated GFR, and the what are the different things that we can do to keep our kidneys healthy. So I have already told you that this eGFR number is important, whether it is 60, whether it is 80, whether it is 70, it's important. Albumin creatinine ratio is also important. Make healthy food choices, because food is which determines our health. So if you are going to make healthy food choices, and you are going to remain healthy, and make physical activity part of your routine, just have your daily routine of physical activity like walking, jogging, etc. And that again makes not only your heart beat healthier, but your kidneys also are make them healthy. Aim for a healthy weight, and I always say that if your waistline is going to be long, your lifeline is going to be short. So beat obesity, and keep your tummy very narrow, and that will add years to your life. And get enough sleep. Unfortunately, I have not got any sleep today because I am talking to you at 3 a.m. Stop smoking, and limit alcohol intake, and express stress-reducing activities. So this is again a regular blood pressure monitoring. So this is a blood pressure monitor that you can invest on, very, very cheap, and you can have it at your home. And this tells you about your blood pressure recordings. So ideally, your blood pressure should be hovering below 130 or 80. And in a healthy adult, that is the way to go. And if it is going up, it is better that you see a physician. So these are the various aspects that I have already talked to you, and we'll go to the next specifics. So if you're, who are all the people who are likely to develop kidney disease? If you have diabetes, diabetes again is a major killer in our modern life. And the second killer is high blood pressure. These killers are very, very silent. They are the silent killers of our modern times. And if somebody has a family history, supposing your dad or your mother or your grandfather or your grandmother or your cousins have kidney disease, then it is likely that there is some form of a genetic risk which is circulating in your blood. And it is better that you check with your physician whether you are at a risk of kidney disease. And people who have already heart disease, it is good that they ask the physician if their EGFR is okay, whether their albumin creatinine ratio is okay. So you can put up these questions to your doctor about your kidneys health. And once we know that our EGFR is hovering between 60 to 90, what are the things that you have to avoid? Avoid preservatives in your food. Very easier said than done, but you try to reduce as much the off-shelf food intake. Avoid sodas, avoid anything on the label that starts with phos, which tells you that about the phosphorus, which we'll be talking to you now. And about the over-the-counter pills like non-steroidal anti-inflammatory drugs, which you take for your backache, for your neck ache and your body ache. And be careful about your iodinated contrast. So what about the diet? So we humans are opportunistic omnivores, which means that we are able to have the ability to digest both the animal proteins and also the plants. So we have the proteases in the gut. These enzymes are able to digest our animal proteins, and we also have the sucrases in the gut, which digest the fruits. And what is happening in the modern day is that we tend to overconsume animal products, often processed meats, which are high in saturated fats and chemical additives. Alternatively, the strict veganism, if you veer to the right, the strict veganism also has its negatives because they predispose us to osteopenia, which means that our bones are not healthy, and sarcopenia, which tells us that our muscles are not having good strength, and also anemia. So we need to strike a balance, and we need to have both a mix of animal and plant proteins. 50 years ago, people thought that the animal proteins are first-class proteins, and they thought that that is the way to go. But now there is a change in our thinking, borne out by the multiple scientific studies. Now we realize that fiber and a potassium and an alkali-rich diet, which is coming out from the plants, is the way to go. So that is the ideal way for a healthy living. So we need to have a good helping of the plants and also fruits in our daily diet. So the dietary fiber comes in various forms, and these dietary fibers are going to give us a lot of health benefits. Not only they prevent colonic cancer, they also provide a good cardiovascular benefit and also kidney benefits. And the multiple scientific studies over the last 30 to 40 years have told us that if you eat a healthy diet, which is populated by mainly fruits, vegetables, legume, fish, whole grain, and fiber, then you are going to live long. And this has been borne out by multiple population studies, especially people living around the Mediterranean Sea, and they have a healthy helping of all these aspects that I have told you, and that is why they live long. And the advantage of the plant-based diets are multiple. They do not have high sodium. Sodium is another very common additive to our daily diet. We are all addicted to sodium. We are all addicted to salt, and that addiction should go. If you are going to have, if you can reduce the salt intake in our food, then we are going to have a healthy cardiovascular future. So they are fiber rich and they are also antioxidants. By taking a plant-based diet, we can also change the microbiome. What do you mean by microbiome? Microbiome is the bacteria that we have in our gut. We have living bacteria in our gut, and there are two types of bacteria, one which does us good and the other which can harm us. So if you take a plant-based diet, we overpopulate our gut with bacteria which do us good. So that is the way to go. So we have a variety of plant-based diets. You can get it from the net. And these are the DASH diet, the plateau diet, the Mediterranean diet, the flexitarian, and the vegetarian diet. So all these are very good for our cardiovascular and kidney health. If you are going to use this from early in your life, from your early teens, if you are going to have a healthy eating habit, then that is going to give you a lot of health benefits as you grow older. So what are the tips for making kidney healthy food choices? Cook with a mix of spices instead of salt, and also have these veggie toppings such as spinach, broccoli, and peppers for your pizza, and avoid processed foods or preservatives, and also reduce your sugar intake, and also read your food labels and choose very wisely your foods which are low in saturated fats, trans fats, cholesterol, sodium, and added sugars. Coming to the phosphate, which I was mentioning earlier, if you take a cup of rice, you will see that it contains 257 milligrams of phosphorus. And if you compare it with the phosphorus in a chicken, it is only 120 milligrams. You will think that if I am eating a plant-based diet, I am going to overeat or expose myself to more phosphorus. But that is not the case. What happens is, even if the phosphorus is there in the diet, the plant diet that we eat, the phosphorus it gets into our system is very less, because the plant-based phosphorus cannot get absorbed as quickly and as easily as an animal source, like say from milk or from chicken. The absorption of phosphorus is very quick and more complete. And in an inorganic phosphate, which comes from the food additives that we see all the time, these are the fast foods that we enjoy every day. These fast foods have addition of phosphates, and this phosphates is very, very bad for our health. This gets absorbed very quickly into our health, into our body. And the red meat also contains a derivative of proteins called TMAO, and this TMAO produces a lot of lipid deposition and also cardiovascular disease. So we should stay away from heavy dose of red meat in our diet. And so dear listeners, I have scared you enough, and you may be asking me, should I go to the jungles? because the Brazilian jungle people have very low blood pressure, and their sodium or the salt intake is very, very less, and their cholesterol levels are very, very low, and their cardiac disease, their kidney disease are negligible, and there is no age-related increase in their blood pressure. So you may be asking me, should I go to the jungle? So it is not possible. We are living in a concrete jungle. We don't live in the jungles. We live in concrete jungles, and we need to do what is best for our body by taking care of our health with the form of the healthy eating patterns, and also know the important function of the kidneys. So I leave now. Dr. Steve will take over. Thank you.
Thank you, Dr. Kumar. It was a great talk. And so what we learned from so far, that you need to know what is your eGFR is. And if it is abnormal, you should act on it. And then you need to know how much protein you're leaking. And so now we're going to ask Steve. So if I am already have lost my my kidney function to about 50% to 60%, or I have gone to stage 4, or stage 4 means your GFR has gone below 30, below 30. So what can you do, Steve? Tell us about it without spending too much money. What can you do?
Well, not surprisingly, some of the best things are incredibly inexpensive. Here's one of probably 50 patients. I'm collecting another 50 case studies. This method of treatment actually is so reliable. None of the doctors I work with have seen a treatment failure if the patient uses the supplements. The total cost per day is less than 25 cents. This is an individual, he's 73, otherwise fairly healthy, mild hypertension. Age is a factor, but you can see on the right and the bottom, everything's in the red. Creatinine, which I don't rely on exclusively, as well as the cystatin C, which I do rely on because it's a bit more reliable. This is an individual with a GFR of 30. At 90 days, we retested him. Everything was green. His GFR went up 100 points. It's one of my best case studies. It's pretty simple. The three things you need are alkali, sodium bicarbonate. And let me put a caveat in there. Sodium bicarbonate does not behave like sodium chloride, which is table salt. They've done extensive, large randomized trials. And on every one of them, the benefit was very significant. It improved nutritional status, it slowed down the disease. And it's largely because kidneys are acidotic from the moment they become stage 1, and it worsens as they descend to the more serious later stages. And the alkali offsets the acidosis. Second, you need to address the phosphorus, as Dr. Kumar mentioned earlier. There's a number of things that work. You can spend $1,000 a month at a dialysis unit on phosphate binders, or you can use niacin. Dr. Sampathkumar is in India, and they don't have access to a lot of the drugs. And for about 2 or 3 cents a day worth of niacin, you can get roughly the same control of phosphorus as you can with $100 or $500 or $1,000 a month medication. That's pretty striking. So what do they normally use? The nephrologist, the referring physician, if they see your phosphorus is elevated, they use calcium carbonate. What's that? That's Tums. And the sodium bicarbonate, you shouldn't use the yellow box Arm & Hammer, but I did use that on my dad. He used my first case study. He went from stage 4 to stage 2 rapidly, and he was already on niacin. So I put 2 and 2 together, and I decided that I needed to find a compendium of literature to support the sodium bicarb, which was easy. It's just a plethora of data, the calcium carbonate, the Tums, and the niacin. And when you use them together rather than one item, there's a pretty dramatic shift in the function of the kidneys. I don't know what they look like 5 years later, but I do know that within 90 days, it creates an opportunity to revisit the risk factors and do a better job controlling the diabetes, the blood pressure, and all the cardiovascular risk factors. Because if you can hold the function closer to normal, that buys time so you don't have to send them to dialysis. If you look at this slide, it's pretty provocative because some of these prescription binders require as many as 24 pills. Sevelamer, in my opinion, Renavela and Renagel are junk. They don't really work that well. And in Europe, they documented they cause intestinal blockage. That's not good. They've actually seen deaths from that. The problem is the nephrologist isn't called in, the GI is called in, and they don't really connected the dots till recently. The safer binders are still rather expensive. Lanthanum carbonate's safe. They don't use aluminum anymore because it's very unsafe. But the first thing you use is Tums, calcium carbonate. Niacin's even cheaper than that. There's no risk of excess calcium, so it's almost perfect. It's a great adjunct. If the phosphorus isn't horribly elevated, it might work as a monotherapy. And Dr. Sampathkumar is using calcium carbonate and niacin with great success in India because they don't have as many options as we do here. Quite honestly, I think we're blowing too much money on expensive drugs where we can use a non-prescription natural supplement that quite handily solves the problem. Next slide.
So Steve, before you go to the next slide, let me
Go
ask
ahead.
you this. If I'm spending $1,000 per month, you think that is do the same job as $1 per month niacin and calcium carbonate or baking soda will do?
Well, maybe or maybe not. Most of the binders are binders. You got a positive charge on the binder and a negative charge on the phosphorus. It's a very powerful atom. It has a high valence, which means very potent negative charge. So calcium, which is positive, will bind it. They all do that. They got iron base, they've got lanthanum base, but they're expensive. Now, interestingly, they refer to niacin in one of the new phosphorus agents. Niacin doesn't bind the phosphorus, it blocks it. So it doesn't matter how many receptors you have that pull it through. Niacin suppresses them in a dose response manner. The more niacin, the lower the phosphorus. And so they came out with a prescription drug, and I won't name it and be rude, but it didn't perform as well as niacin. And it would have been several $100s a month. So common sense would tell me that's a good place to start. Don't overdo the calcium. 2 grams of elemental calcium is 5 grams of Tums. So read the labels. And a little probably goes a long way there. You don't want to overdo it. But niacin, either use the active niacin, which I prefer because you get about 100 benefits. The NAD, niacinamide, nicotinamide, is a first pass metabolite after the real niacin on the left goes through the liver. And that performs equally well on phosphorus. But if the patient can take a small amount of niacin, Dr. Sampathkumar uses active niacin at 0.5 gram. It works. I recommend using active niacin with the help of somebody who's got several years of experience. I've got 20, so I get a lot of referral to successfully place patients on niacin. And I love doing it because I know I'm doing the right thing. This is Dr. Sampathkumar's.
Okay,
Go ahead.
Dr. Kumar, I mean, you don't use those $1,000 pill a month in your patient, do you?
He does not.
Yeah.
So
we,
how do you decrease the phosphate in India by spending a lot of money, or little money?
So I was interested in the use of niacin for my patients, born out of studies which came from Japan. And I started using these very low-cost niacin tablets for my patients who had high phosphorus levels, especially those people who had advanced forms of kidney disease in the form of stage 4 or stage 5, and people who are already on dialysis. And I could see that there was a dramatic reduction in the levels of serum phosphorus in those patients. Phosphorus is an ion which can get deposited along with calcium and stiffen your arteries. It can stiffen your heart and make it more stiff so that the blood pressure can go up, and also cardiac disease and heart disease can go up, and sometimes people can die suddenly, so sudden cardiac death. So these can be prevented by taking a pill which is very, very cheap, and it, as Dr. Steve told us, that it has got an action which is different from the phosphate binders. It prevents the phosphate transport across the intestine, and so it is a blocker, and it produces a real reduction in the phosphate levels. And this paper, which I had published many years ago, gave me the chance to look at the various investigators across the world who have used this drug to great benefit. Unfortunately, the pharmacy industry or the drug industry is not very much interested in using this drug, which is very, very cheap, in a case control study of large magnitude involving thousands of patients. That is unfortunate. And so we are left with very small single center studies which borne out the importance of reduction of phosphorus with the help of this low cost drug.
So Steve, why you keep that secret from us? You know, most of the nephrologists in US don't know much about it, or they don't believe in it. And
well, I think there's a lot of just common sense reasons. Who does a nephrologist see? Almost exclusively stage 4. And the concern is these people are going to end up on dialysis if they don't die. So a lot of things are instituted at that point, but we miss 80 to 90% of them until stage 4. That's why in the beginning we recommend you get the urine checked, not just the blood. And that'll help us determine what stage you're at. If 80 to 90% aren't getting diagnosed till stage 4 in the United States, we're doing a worse job than almost any other disease state with diagnosis, because we don't even know it's the patient is at risk for their stage 4. Plus, there's a stigma around niacin and sodium. And what I found is I read nephrology journals on a weekly basis. Not everybody does. And I'm a bit disappointed in that, because sodium chloride is a problem because of the chloride. Sodium behaves differently in bicarbonate. There's no need for more hypertensive blood pressure meds. The blood pressure didn't go up. There was no edema. In fact, some of them, they improved. And it's only 4 cents for the dose, the starting dose, to control the acidosis, which is hidden. You have to know what you're looking for and how to find it. The bicarbonate doesn't deteriorate until stage 4. So there's a lot of moving parts here, but the patient, all they need to know is, I want to know how much protein is in my urine. I want to know what my GFR is. And if you can't get anything more than a creatinine, at least you have those two. But if you get a cystatin C, that'll tell you at the lower stages, are you 1, 2, or 3A, or 3B, or 4? You need to know that, because when you get on the treatment, you want to see the improvement, and you don't want a false representation of that. You want an accurate representation. And I think it's just a paradigm. They've tried to smear niacin for about 12 years now. It was the first cholesterol drug. It was the first one to lower heart attack and stroke. And it created twice the risk reduction in diabetics. So a lot of what you hear, I'd be skeptical, because I've had nothing but clinical success for 20 years. And if you want to look up somebody famous, Dr. Tsimikas, Tsimikas, he's in Scripps Institute and the University of Southern California, San Diego. He is a current world expert. He uses niacin all the time, and beware of statins. Anyway, niacin has a lot of utility. While you're fixing your phosphorus, it's fixing 100 other things. And for 5 cents a gram, I can't think of an excuse not to use it. It takes a week or 2 to get on board, because you can't start them at a high dose. You have to titrate them. I do 2, 3 every day. And once the patient has the information, they do fine. Dr. Castelli's protocol is the one I use. I figured he did this 50 years ago, and he's much older than me. He's retired, but he knew what he was doing. It was the only drug they had back then.
So let's see what we have so far is we recommend that you should take care of your kidney health. It takes very little money, like almost $2 or $3 in India, or maybe about $50 in US, to find out the kidney health by just finding whether you are leaking protein in your urine or what is your EGFR. And once you find the problem, like stage 3, stage 4, by spending very little money, maybe $2 a day, you can reverse the kidney function and avoid the dialysis. So let's see what happens. What happens once you go dialysis? The dialysis make you feel better? Well, it does not. The quality of life goes down. Either it does keep you alive, but mental capacity deteriorates rapidly. Does not remove as many toxic as your body can. Treatment for 48 hours apart means the minute you get dialysis, then you go 1 day break and then go back again. That affects your lifestyle, severely impact immune response, and can cause Alzheimer and dementia, accelerate calcification and atherosclerosis. So dialysis is just a touch-up to keep you alive long, but it does not improve your lifestyle. And even
I think
if
it's a
transplant.
I'm
Go ahead.
sorry.
Steve.
The number one cause of dementia and Alzheimer's in the United States, it could be worldwide, but in the United States, is kidney disease. When your kidney's not removing toxins, those toxins are affecting your whole body, and the brain, it's noticeable. There's very few symptoms until stage 3B, stage 4, it varies, but you need to know what stage you're at. And we mentioned the two tools, the urine check and the blood measurement. Now you know where you're at on day one. And these supplements are very inexpensive. They're easy to get. Most of my patients go to Amazon to get it. And I help them. I give them pictures, show them the price, show them how to administer it. We start with the lowest dose and see how far we get. Most of my case studies are taking the lowest dose. There's a 90-year-old on one of my case studies here. We might want to move towards that. When you're on transplant, I think it's important to know that you're getting a new kidney, but you're not getting a new body. So let's say you're overweight, you have diabetes and blood pressure. Those don't disappear because you got a new kidney. You've got a second chance, but your body will affect the performance of that new kidney. And there's a lot of data on that. So it's not the end all. And I had a doctor in Atlanta tell me that there are actually 3 options when you get to stage 5. Dialysis, there's peritoneal home dialysis, and of course, the dialysis clinic. Transplant, and there are very few organs to go around. So it's a very lucky person that gets a transplant. And hospice. And it just reminds me when I reversed my dad's kidney disease. When he found out he was stage 4, he said, "I'd rather die than go on dialysis." My mother broke down crying and called me. And end of the story, he was one of my first patients. He went from stage 4 to stage 2 at the age of 81. I felt pretty good about that. My own dad.
That's great story, Steve. So let me tell you what we want to talk about, tell you about a message we want to give it to our audience is, so kidney health is very important. And when kidney fails, it's not only it affects most all of the part of the body. It affects your heart, affects your electrolyte balance, you develop anemia, immunity system goes down, you get demented, and your endocrine system doesn't work. Also start having thick skin and itching skin. So it's really worthwhile when you go to your doctor, check your kidney health. Just ask 2 questions. 2 questions, and then once you know it, take charge and get better. So Steve, tell us about your case, how a 90-year-old man who's still alive, and how did you help him?
I love talking about this guy. I'm not that tall. I'm 5'5". You know, I'm short, furry, and funny. I'm not tall, dark, and handsome. This guy was an attractive 90-year-old. He looked in great shape, but his lipids, his cholesterol particles were way out of range, and he was stage 4. And Dr. Finney, when I'm in Texas, I usually see patients to assist them because I can put more time in than they have paid for by the insurance company. They have 12 minutes. I take half an hour with a patient. He comes in, he hardly said anything. His 50-year-old son looked like a train wreck. He was at least 50 pounds overweight. So I thought, wow, he's stage 4 and he looks great, very muscular. And I asked him, how do you stay so fit? And he said, I chop wood. His neighbors and anyone nearby brings dead trees over, and he uses an axe and chops the wood until he gets kind of sweaty and tired, and that's his exercise. And he looked like it. But he's 90, and there are a couple subtle things there that cause his kidneys to go into decline. Plus, he's 90. So he didn't say much. I told him what to do. I gave him printed material to take home. I repeated it several times. And Dr. Finney called me 2 or 3 months later and said, Mr. Mueller, you should see his lab work. And I said, how does he look? He said, I don't have enough time to talk. We'll email you the results. I looked at the results and it was stunning. Not only did his kidneys go back 2 stages, that's the panel on the right side. He went from a GFR of, it was down between 35 and 40, I think. I can't read it from here. But we got him all the way up to the upper limit of, I think it was stage 2. Now that's pretty good for a 90-year-old. But when you look at his cholesterol profile, the particles, they went from red to green. And we spent a whole 5 cents doing that, 5 cents worth of niacin. He took the sodium bicarb, 3 tablets, and he took a half of a 1 gram Tums at lunch and dinner. So even though he didn't say much, I kind of sensed he was going to do it, and he did. It's pretty clear that he followed instructions, and he couldn't be happier. He'll probably live to be 100. I just suggested he doesn't walk in front of a bus, otherwise he had a lot of mileage left. I was very happy. This is a front page of Orthomolecular Society. They published my first 25 cases. It was kind of anecdotal, but I've had that republished as of last year. And now the chief editor of the magazine for integrative functional medicine wants me to put a more formal peer-reviewed version together, and I'm working on that. But we've got evidence, and not a small amount, and it's all based on a large number of nephrology journal studies. They come from different sources, experts on treating acidosis with a sodium bicarb, experts on the niacin, and so forth. So I don't do anything willy-nilly. I want to know that the science supports it, it's safe, it works, and it's actionable. Niacin's actionable if you have somebody with experience. And most of my doctors, that's 90% of what I do is start patients on niacin, and I enjoy doing it. I enjoy it.
Okay, now we almost at in the end of webinar. I have, new question came in my mind, and I'm going to put it to Dr. Kumar. And so, see, what I see here, you told me today that there are 700 million people worldwide who has kidney failure, the dysfunction of kidney, and only 10% know them. Only 10% have diagnosis. What about rest of the people? If we don't know the problem, how we can fix the problem?
Right.
So
this is where regular health checkups are important. Screening, so large scale population screening for kidney disease with very simple tests like urinary albumin.
Yes or no?
All right. And while we wait for results to come in, I've got another question that I can put to the panel. So this came in this afternoon. What are some symptoms that I should be aware of early symptoms of kidney disease?
Yeah, one of the early symptom is no symptom. So that is where we are talking about early diagnosis. Once the patient starts developing symptom, it shows that the kidney disease is fairly advanced. So what are these important symptoms? One is sometimes these patients can have blood in their urine. So this is called hematuria. If they have blood in their urine, it is ideal that they reach out to their physician and then check what is their kidney function. The second aspect is that they develop mild leg swelling. So this is called pedal edema. And this mild leg swelling just comes on when they sit for long hours in front of TV or when they travel in a bus or a train. And then it seems to go away when they are active. So this on and off phenomenon of leg swelling also could be important, and you need to check whether your kidneys are functioning normally. The third aspect is blood pressure. If somebody has high blood pressure, always check whether they have kidney disease, because one of the markers of kidney disease is high blood pressure. These three are very important.
So let me ask you another question. Judah, if it's okay, and then, or do you want to ask a question first?
No, good, Doctor.
Okay. So next question is, if you go to the doctor again, please, would you ask him what is your urine albumin creatinine ratio is? Yes or no? So the reason I'm asking this question, did we make any difference in education of our general citizen? I personally believe that you are the one who should take care of your health, because your health is wealth. If you depend upon your doctor, your doctor will going to tell you about your kidney failure. By the time you get there, it's about stage 3 or 4, and I can tell you that Dr. Kumar can tell you when do you see patient, when the patient referred to you, how much kidney function they already lost before they see it.
Very unfortunate fact is that we as nephrologists, we as kidney specialists see them in very advanced stages of kidney disease, not when they have early forms of the kidney disease. And most of these patients are either not seeing their physicians, or they are seen by physicians but not tagged on, and the kidney disease is not flagged on. So we see patients with very advanced stages of kidney disease, and we just tell them that your kidneys are not functioning to even 5% of their capacity, and you need to get ready for dialysis. Very unfortunate.
So hopefully we have awakened our population here. Maybe down the road, when you see this webinar, this webinar will be available in Health Well Safe YouTube channel. Please subscribe our channel and take responsibility for your health. So Judah, do you have more questions from our audience?
Yes, sir. We've got a couple more questions. The next one is, are there any conditions that cause kidney treatments that we discussed to be ineffective, such as any autoimmune diseases that I should be aware of?
See, autoimmune diseases like systemic lupus erythematosus, sometimes rheumatoid arthritis, Sjogren's syndrome, these diseases can affect the kidneys, and we need to treat them with immunosuppressive drugs. And if in an advanced stage, these patients may require advanced treatments of requiring dialysis and sometimes kidney transplantation also.
Great.
Very good. So we got 2 more minutes. Anybody else has any question or final thing you want to talk about, Dr. Kumar and Steve McConnell?
I've got one more question that I'll sneak in from the audience. This came in this afternoon as well. Is it true that in the United States, protein is pushed on consumers too much and that we don't actually need that?
So I think Steve can answer this.
I think that too many things are pushed upon us. And Processed foods are inexpensive to manufacture because they're full of phosphorus. They keep for a long time. So that's good for the food industry. I think Archer Daniel Midland has a lot of blood on their hands because they popularized fructose, corn syrup, corn sweeteners. And they're the largest supplier to my knowledge. And because it's so cheap, that's what all the food manufacturers use in their potato chips and their products. And to keep it from going bad in a day or two, they put various forms of inorganic phosphorus in there. You got to read the labels. If it's got a PHOSP, that's phosphorus. And there's various types. If you look at a Coca-Cola bottle, it's got phosphoric acid. That's phosphorus. If you eat healthy protein, you'll do far better. But preserved meats, unfortunately, I do like Italian sausage. My wife is Sicilian. And to keep it from going bad, there's a lot of phosphorus in it. So I'm a little bit more judicial about what I eat, but ideally vegetable matter is far healthier than animal protein. I have to say, though, this is the United States, and I've watched the failure rate for diet, exercise, eating a healthy lifestyle and so forth. And the failure rate is quite high. Dr. Castelli said he tries to get them to do it. This is from 20 years ago. It's worse now. But it doesn't get done. And that the guideline writers were wrong. The ATP 1, 2, 3, 4 was wrong because they let off with lifestyle. If it's got a 95% failure rate, now what do? They have to take the medication. And in my world, I like natural products because I hope I don't offend anyone. Our creator made them, and they're probably better designed than Merck and Pfizer. And they happen to be incredibly cheap. They're usually safe. And the patients prefer them because niacin, baking soda, calcium carbonate. I use a lot of berberine and milk thistle. They're not expensive. If you got an Amazon account or like my mom's 92, we have to go to Walmart for her because she doesn't know how to use a computer, but it's easy to get their hands on. You don't need insurance or a script. And I still recommend a provider who has experience. Let me repeat that part. Somebody who has a lot of experience with niacin, somebody who's used to using natural products, because their belief system will lend itself well to assisting the patient in their journey forward. And I almost always get clinical success. I don't have the challenge that Dr. Kumar has with late stage patients, but I'm trying to keep them from becoming late stage. And I've noticed that there's two words that motivate patients: dialysis and stroke. And I don't like using those words carelessly, but when they realize what they're up against, sometimes they don't realize. They're more inclined to hunker down and exert some discipline and do what they need to do to save their life, to save their kidneys, to preserve their health. And when they do it, I almost always see some improvement. And I got to tell you, in all honesty, niacin's my favorite therapy. That's one of the reasons I asked Dr. Sampathkumar to join us, because he believes in it. And I want to thank him again for that, for making himself available.
Well, thank you. We are all thank our speaker, Dr. Kumar, Steve McConnell. Great talk today. We wish you a dialysis-free, stroke-free life. We want you to really, we believe that your health is your wealth, and we have a a patient app. You can store all your information there and take charge. Take charge that your kidney stay healthy as long as you live. So wish you, thank you for joining us. And you can go to our website. You can go to Health Well Safe YouTube. Please leave the comments and put the suggestion if you have any for us. Thank you, Judah. Thank you, Chesko. Thank you, Kumar. Thank you, Steve.
Thank you.
Thank you for joining our webinar. Be sure to follow us at Health Well Safe on all social media platforms so you can stay up to date with new healthcare technology. If you have any questions, please email us at info.healthwealthsafe.com. And remember, your health is your greatest wealth, and we want to help you keep it safe.